Hello, everyone. Welcome to the third session of the Health Center Preparedness and Response Forum. I know people are currently joining us. My name is Alexis Guild. I am with Farmworker Justice. I will be co-coordinating, co-facilitating today's session. And today's session is really going to focus on extreme heat and wildfires. So as people join, next slide, please. We are just going to go over a few housekeeping items. And for those of you who have joined other sessions, you are very familiar with these items, but all participants are muted and videos are off. But we encourage you to use a Q&A or the chat box. We want to hear from you. So if you have any questions or comments, please go ahead and use the Q&A or chat box. Also, please feel free to introduce yourself and say hello, because we love to see who is on the webinar today. So please feel free to use the chat to do so. And I see many of you are doing so, so thank you. The webinar is being recorded. And so the webinar materials, the PowerPoint, all of that will be shared about a week from now. We also have a Google site where we'll share the link and you can access the resources from this webinar, as well as the resources from the previous two webinars. And of course, we always love to hear your feedback. So please go ahead and fill out our brief evaluation at the end of the session. Next slide, please. So for those of you who may be new to the Health Preparedness and Emergency Response Forum, this is a collaboration of numerous national training and technical assistance partners. All of the NTAPs who participate in this series are up on this slide, and this is a coordinated effort in order to share information with all of you and provide resources helpful for your health centers and your communities. Next slide, please. So as I said, my name is Alexis Guild. I am with Farmworker Justice, and I will be facilitating today. I am thrilled to be joined by my colleague, Elena Boyer. Elena, do you want to quickly introduce yourself?
Sure, wonderful. Welcome, everybody. Thank you for joining us. My name is Elena Boyer. I am Senior Director of Programs at the National Healthcare for the Homeless Council, and I'm coming in from Nashville, Tennessee today.
Thanks, Elena. Before we kind of jump into our topic of wildfires and heat, we do want to recognize the storms that occurred in California. I am in California, so I certainly know the impact. So we wanted to just check in with all of you, see how you're doing, see if your organization was impacted by the recent storms, especially in Southern California, and just share any information you would like to share with us at the moment. So we want to provide just a little bit of space. So please feel free to go ahead and type into the chat. And perhaps we have a speaker who is based in Southern California, so she may also have some comments and thoughts as well to share. We'd love to hear about that, but we just want to make sure. So Candy, you shared that you were impacted in San Diego. And so, would love to hear kind of more about that when you present and what the response was and what the needs still are. Well, we certainly encourage you to share in the chat. And again, we just wanted to kind of take this time and space because it did happen very recently. And so we want to just check in, especially since we're focused on preparedness and response. It's something that's really pertinent to the work that we're doing and the information we're sharing in this series. Next slide, please. So today we will be just talking specifically about wildfires and heat. We are going to present just a brief overview about the impacts of wildfire and heat on specific priority populations, just to really just provide some context and framework for the discussion. And then we will be joined by Julie, and I apologize, Julie, that I don't know how to pronounce your last name, from NOAA, who will share a national perspective on the impact of extreme heat and wildfires on at-risk patient groups. And Julie, please go ahead when you join to confirm your last name and the pronunciation, but I apologize for that. And then, great, thanks, Julie. And then we will be joined by Candy Alvarez from the Health Center Partners of Southern California, who will talk about the work that they've been doing in Southern California at her health center around wildfire preparedness and heat. And then we will close with resources, discussion, and evaluation. So next slide, please. So I am going to kick off the discussion by talking about outdoor workers and heat and wildfires. Farmworker Justice, we are a farm worker organization. So of course, we do a lot of work focused on the farm worker population and the impacts of climate change, including heat on farm workers. It's important to note that generally farm workers have limited protections. When it comes to heat and wildfires, there are very few protections for outdoor workers. There is no federal heat standard, there's no federal wildfire standard. So there are no federal protections for outdoor workers when it comes to heat and wildfires. There are a handful of states that have implemented protections. For heat, 4 states, California, Washington, Colorado, and Oregon, have implemented a heat standard, so regulations related to heat and protections for workers, both outdoor and indoor workers, around heat and different standards that employers must abide by when the temperature gets to a certain degree in order to ensure that workers aren't affected by heat-related illness. And then Minnesota also has a heat standard, but only for indoor workers. And then for wildfires, only 3 states currently have protections for wildfires for workers, and that is California, Washington, and Oregon. So just specifically about farm workers, they are 35 times more likely to die from heat-related illness than other workers. And studies indicate that about 2/3 of workers do not receive training in heat safety. So I share this just to kind of provide the context and just to share about the disproportionate impact that heat and wildfires have on outdoor workers generally and farm workers specifically. And with that, I'm going to turn it over to Bob Burns.
Thanks, Alexis. Bob Burns, National Center for Health and Public Housing, focused on health outcomes for residents of public and assisted housing. And real quick, relative to heat, folks in public housing often do not have air conditioning, and some very minor things like lack of insulation and windows painted shut, which during extreme heat is a real problem. Also, a number, 50 or 60 public housing agencies will be impacted by sea level rise and will be kind of flooded out. A lot of them in states, as you might expect, along the coast, working down kind of Massachusetts, New York, New Jersey, a lot of the folks who were impacted by Hurricane Sandy. Beyond that, the population itself has a high concentration of elderly, disabled, pregnant women, small children, all of whom were impacted. And we have a lot of folks, complex patients with chronic conditions, that including obesity, diabetes, COPD, as well as mental health issues, all impacted pretty heavily by extreme heat. And with that, I'm going to turn it back to Elena.
Thank you, Bob. Back one slide. Thank you. Thank you, everybody. I'm just going to, similar to Alexis and Bob, just talk a little bit about those who experience unsheltered homelessness. We know homelessness can look many different ways, but specifically when it comes to extreme heat and wildfires, we were really most looking at our most vulnerable population, those who are unsheltered. So those that reside on the street or encampments in the woods or even in their vehicles. So one of the things that we think about when it specifically comes to extreme heat is poor ventilation, even inside tents. And so that's something to consider kind of when those are living in encampments, what kind of ventilation, what kind of windowing or fabric do they have with the tents? We have a lot of people who might sit or actually fall sometimes on the street. We heard a lot of stories coming out of Arizona where we had older populations that might fall on the street, and they end up getting burned during the high heats, and they can get second and third degree burns. And so then you have complications from wounds that occur from that as well. So it can certainly be ongoing and a chronic issue. Some prevention measures that are taken across the city continuums of care often try to help manage the cooling centers and when those actually open, what degree do cooling centers open. We also have hydration. We have a lot of providers that are on the street that provide water, thinking about community spaces a little bit differently, malls, libraries, day shelters. And when it comes to wildfires, it's very similar to what Bob was talking about, very poor air quality. And so these are folks that are spending most of their day and their life outdoors where they can't come in and get away from the poor quality air, and they already might have asthma problems as well. So some of the prevention measures that we really look towards are masking, providing masks for those populations, and finding indoor shelter. So again, looking back at those community spaces. So that's just a little bit of highlight. And at this point, next slide, I will introduce our first speaker, Julie Treton, and she is from One Health Lead. One Health and Integrated Climate and Weather Extreme Research Lead at NOAA. She also has led the National Integrated Heat Health Information System as well. So we're just so excited to have you here. And with that, I will pass it over to you. Thank you.
Well, so hello, everyone. Thank you very much. My last name is Tartan, but everybody just calls me Julie T or Julie, so don't worry about it. I'm totally happy with that. And I'm actually just even more elated to be here with you. I'm going to give you a high-level overview, but the opportunity for us is being asked to be here because part of what we do on the federal side is really specifically targeted to help serve the people of the United States, and specifically with heat, which is my primary focus, less so wildfires, but there's certainly an intersection. I'm hearing, we already have a focus on how to reach our unhoused and poorly housed populations, and you all are already doing that. And so, and I think with farm workers, I think at our annual heat meeting that we had last year and the one we're planning this year, we've had a whole discussion on farm workers. So I'm very eager to give you an overview of what we're doing and maybe some resources that, either tell you more about what you know or maybe tell you about something you didn't know, but also to kind of continue the dialogue because I think, Bob, thank you for including NOAA and NIHIS and the US government in this conversation because we really need the connection and you all are really working with the folks we're trying to reach. So, all right. Without further ado, I actually lead the National Integrated Heat Health Information System along with CDC, and I'll tell you a little bit more about that. There's about 27 different federal agencies involved in this at this point, so you'll understand a little bit more as we move forward. So let's go to the next slide. Little bit of context setting. And so this isn't a NOAA presentation, but you might wonder what NOAA, the National Oceanic and Atmospheric Administration, is doing here. If you hit one more, I believe you should get the middle part. We do weather, climate, oceans, fisheries management, some regulatory, but only in fisheries, sanctuaries, charting, all that. But our job is to predict risks to the economic health and well-being of the United States and its participants. So both domestic mostly and a little bit abroad. We also conserve and manage coastal and marine ecosystems and resources, which has a lot to do with, as Bob mentioned, sea level rise and like. So we're the prediction folks. We manage coastal waters, international waters, and that's what our role is. And so part of our job is to figure out what environmental information we should be observing and surveilling, how it links with the health information, how it provides you with the information you need to make decisions about the populations you serve. So we kind of back into it from the discussions we're having here is what do you need? How can we help? What is it we're trying to do? Here's what we're working on. How can we improve it? So that's kind of the NOAA role in it. And then we also lead the interagency efforts on some of these things too. So, all right, next slide. So I started with a bit of an overview. If you keep hitting that, you'll get to the outside circle, right? So the inside is basically the climate parameters, and then it gets to the more direct effects of, temperature, sea level rise, and the like. And then if you look at many of the circles have a heat and wildfire or air quality component to them. And you get all the way out to infectious disease, you get out to conflict and civil unrest and mental health issues. So even if you're looking at it from a lens of heat and wildfires, you have a pretty broad lens of what kinds of populations are being affected by this. And we already heard from the farm workers and from those who are poorly housed or unhoused and advocates for those, but there's a lot more even than just that in terms of looking at the heat and the wildfire impacts. So if you could, next slide, please. I'm not sure that One Health is the most important message to take home from here, but I do want you to know that from the earth science and the prediction side, we are looking at it holistically, looking at the impact on ecosystem health, animal health, and human health. And we have a program that does that in NOAA, and that's what I lead. So next slide, please. The components are basically the, vector-borne, waterborne, heat extremes. We actually have some focus on marine zoonotics and pharmaceuticals from the sea, food production, both drought related and aquaculture and marine related, things that you might not think we do at NOAA. And then we have a regional focus and a lot of international work too. So that's kind of how we end up in this space. It's important for us to understand what observation systems, what predictions, what forecast tools, what information that you all need in your daily job to be able to better plan and prepare for these events, which we know are coming. Next slide. So I don't think I have to tell you that it's getting hotter. And I think one of the quotes that I like most recently is that this summer might be while it's hottest ever, it might be the coolest one in the next 20 years. So the world is changing, the climate is changing, and it's definitely getting warmer. And I think we keep seeing that exactly. All right, next slide, please. You look at the projections. Even now, we're seeing the impact of short-term predictions now that are having huge impacts on our economy, on our society, on our people, on our livelihoods, and especially those who are least able to protect themselves or understand the impacts and prepare for it. So I think the whole point here is, how do we get ahead of this, right? We know there's a problem coming. We already see it, as you just mentioned in entry to this whole conversation. We're seeing this every day in a different way. So if you can go to the next slide, please. We know that it has impacts both on livelihoods and workforce, as well as the food supply and livelihoods regarding to domestic livestock and agriculture. There are so many ways in which heat affects our populations and our livelihoods that I think we have underestimated the impact. We don't have the data to quantify the numbers that we cite. They're what's quantifiable, but there are clearly and well acknowledged underestimate of the impact, both in livelihood, morbidity, mortality, and economic impact. Next slide, please. It also, if you can hit just maybe two more, there's a couple more pictures that will come up here. My point is also that it's not just the direct effects. We know that heat affects mental health and well-being. We know it affects civil unrest and conflict. It affects our ability to respond both domestically and internationally. It affects our critical infrastructure. There are a lot of components to how heat and wildfires both affect our economy and our populations directly and in synergy with each other. If you could go to the next slide, please. The other piece, and I'm getting into a little bit about what we're doing about it, is that heat, and I think my lesson for this is that wildfires is a little bit similar, but heat for sure is one of those issues that is overlooked by for a number of reasons. First of all, the data just are hard to collect and they're not well quantified, and we know we underestimate. They affect the most marginalized of the populations who are least able to advocate for themselves, although on this call, there are many of you here who are representing those underserved populations. So I'm happy to be connecting here. It falls between the cracks of governance, both at the federal level and state and local levels. And I'm going to get to an action. So just here for a second, there's going to be an ask of every single one of you on the phone here, because there's a way that you can get your communities involved in heat management coming up. Just saying. And then sometimes it's just human nature. It's easier to wait for a disaster. Our economic systems are set up to wait for a disaster, but that's not the best thing for us in the long run. So there's a lot of reasons why heat governance is an issue, and why we need to do a better job of these kinds of things here. What we're doing is talking about how we all should be working differently. It requires a different paradigm. All right, next slide. I pulled this out specifically. I won't spend a lot of time on it, but I just thought it was worth noting that there is an increasing awareness of the impact of heat on mental health. And I know that affects a lot of the populations that many of you on this call are serving. And so whether it's affecting them directly, as you just said, what is the temperature in the tent? What medications are people on that make them more vulnerable, that aren't being recognized? What is the risk of increased domestic violence or civil unrest because of heat? Those are all numbers that are pretty frightening. And there's small margins of increased heat that are making pretty significant magnitudes of impact on how our populations behave. Next slide, please. So this is a really short, it could be a long slide or a short slide. Back in 2015, the federal side of this equation recognized that we were doing a lot of work on heat, but it wasn't well coordinated. It wasn't necessarily synergistic, little pockets of this here and there. And we weren't necessarily dealing with the long-term consequences and impacts of that. So we launched the National Integrated Heat Health Information System, we being NOAA, the Weather Service, Climate Program, CDC. And that was in 2016 under the National Security Council. We were asked to run that through administrations, and this administration, you'll see at the bottom, supports and implements the White House Extreme Heat Interagency Working Group. This administration's clearly recognized heat as an important area, wildfires is an important area, and there are complete, facilitated working groups that are trying to figure out how to better manage this and to provide information out that we can do to better serve those of you who are actually trying to use it and help people directly. So the NIHIS Interagency Group has been around for a while, and the White House group, just for this administration, they have merged. And it's if I have time later, I can talk to you a little bit about what we're all doing. But for the federal side, that's a pretty powerful thing. And then that helps. When Bob reached out to me and said, "Could you speak to this group?" It's great, because we are absolutely looking for those more practical and hands-on connections with those of you who are managing the populations, which we have articulated that we're trying to serve. So it's a team effort. Next slide, please. These are a few of the things that are structured of how the National Integrated Heat Health Information System works. And the basic message here is that it starts with, what is it that a decision maker needs? What is it that you guys need to make a decision? What populations are you trying to serve? And what do you need from us to help you do that? And then it backs into the observations, the research, the products and tools, and the communication about it. So that, it's not rocket science, but sometimes it's hard to do. So that's basically the whole structure of NIHIS and the whole structure of the US government's work on heat, and hopefully increasingly wildfires. All right, next slide. And just, so you were talking about some of the policies earlier. So this is kind of the federal landscape of what's involved here. It's both understanding the problem and the coordination on that left side, coordination. And then I'll skip over a little bit. There's research and some tools and stuff, which I'll show at the end. Policy and regulations. OSHA's actually got some rulemakings in the motion. It's my new awareness how long that takes, but they are working on that. So that it does take many of you, and I believe some of you have been involved in NIHIS National, and we're talking about this a year or so ago. So I think the regulation and rulemaking is coming, but it's takes a while. And then we've got the low-income heating and energy assistance program, the block grants, the brick grants, a lot of capacity, the USDA tree planting programs, really trying to help communities protect their citizens from heat, and increasingly wildfire. So these were started with heat, but there is a heat and wildfire component to some of this. So I'm not ignoring the wildfire piece. All right, next slide, please. Then I'm going to go into a little bit of detail, but I feel like I don't want to go into too much because I want to make sure we have time for conversation. So if you could go to the next slide, this is a little bit about what we're doing in our urban environments. And I recognize fully that citizens that are affected by heat are not only in urban environments, and we've already heard about outdoor workers and rural populations and migrant workers. So this is a bit on how we're managing the urban risk, but certainly we have other components that are working on outdoor workers and actually indoor workers at risk, arbitrars and people who are in factories and that sort of thing. So we have a lot of pieces to this activity. But for those in urban environments, for whatever the workforce is and wherever you're living, we're doing a few things to manage the heat risk. And some of them are urban heat island mapping. There is a resilient scorecard that we're trying to develop that will encourage cities and communities to kind of take these, it's a bit of a checklist, but it's a starting point. We're doing some tabletop exercises to help communities really think through and map through and integrate the right agencies and community organizations and community-based organizations into the planning and preparedness. And then actually we have an equity and just environmental justice mapping tool that we hope will be helpful in trying to identify where those populations are most at risk and where their heat risk is greatest, and then help target some resources and intervention efforts. All right, next slide, please. Let's skip over that one. We've mapped over 80 communities right now in the United States with our urban heat, and 3 globally. We learn a lot from working with other cities and other communities, but our primary focus is, of course, US. And so this is something that's really fun. If you haven't been involved in one and you're interested, you can follow up with me. The announcement just closed for this past year, but communities go out mapping for a day. It's just one day. It's pretty low lift in terms of science, but it's a very engaging community science, citizen science organization. And it helps people understand where they are in the heat load and gives the communities an option, a plan for how to determine the best intervention strategies and the best investment of resources. Next slide. I think that one is, the next one is, an example of Sacramento. So you really have a subset of a community, and people go out, it's in cars and walking, bike sometimes, and it's a very engaging opportunity, and it's a great opportunity to have like mayors and local dignitaries and stuff kind of come out and say, hey, we're doing this to help about heat and wildfire. So yeah, next slide. All right, this is the, if you hit one more, this is the environmental justice tool. It's on heat.gov, but it has a basics of where your it's a CDC's environmental justice criteria that's on there. So if you have additional information that you can add from your local community, that's additive, and there's a way to do that. But it helps you determine, if you say you do an urban heat mapping campaign, or you just want to know where your most vulnerable populations are, like you don't already know that, you can use this environmental justice tool and kind of overlay the mapping and the tool to help determine and make a case for how you should invest some of the dollars into the most vulnerable population. So that's the whole point, is there's an environmental justice tool. It is a national tool. So some communities will have more granular information, but at least as a baseline for all communities to be able to access some basic arguments for why they make the investments they're making. Next slide. All right. This is another example, or an example of the difference and kind of how you can understand your heat risk granularly. This is also important for understanding the wildfire impact. And I want to pause for a second, because heat is just one hazard. And I would imagine that some of you are thinking, yeah, I can't just manage heat by itself. I've got to manage heat and wildfires, or heat and flooding, or heat and drought. And we know that. So That's why the environmental justice tool and the mapping tool we're being able to help kind of combine the layers of impact and where the risk is. And I will say the heat and drought, we've talked about heat and wildfires is harder because, you know, smoke moves more quickly than heat, but not a whole lot more. All right, next slide. All right, so in case you're getting bored yet, this is an example of what an urban heat island campaign looks like. It's a very engaging activity. So if you're interested in doing this in your community, please follow up with me. We have, we're about to select the next year's awards, but we've got a couple of centers that are going to be working on this stuff in the future. So if you don't have a map, you don't understand the vulnerability and you need some help with that, or just want to be engaged, please follow up with me. My email's at the end of this thing. All right, next slide. Then this is just kind of, these are some examples of what communities have done. They've done tree campaigns. That one in the top middle, social vulnerability and adaptation in Oahu, that's a tree planting campaign. They've included heat in their own action plans, in their own community action plans. They've actually done some outreach material and developed some new communications material for their local communities, obviously translated into local dialects, so certain languages that are more prominent in communities. So I have a lot of those kind of tools available. If you're interested, before you go develop them again on your own, please ask if we have it already, because we've got a lot of these things kind of in store that have been translated into, I think, 20 some odd different languages already. So let us know. Next slide. And I know I'm about out of time. Skip over that one. These are just cooling options, if you don't already know that. All right, resources for heat. And then we're going to go to wildfires. If you haven't checked out heat.gov, please do that. We have categories at the top by most vulnerable population or the most exposed populations. And we are actually doing a webinar series on actually poorly housed and unhoused populations to start, to try and actually embellish what we have on heat.gov so we can provide better resources for underserved and most vulnerable populations. We have already we've done one on LGBTQI+. We've got the one on poorly housed and unhoused populations. We've got one on incarcerated. We've got one specifically on mental health and mental illness. And I can't remember the last one. It's in August, so sorry, but it's on the website. So if you haven't checked out heat.gov, please do that. Next slide. We are also doing a massive federal heat season communications campaign, and this is from the White House all the way down. So we have resources and materials, and we would love, love, love to work with you. If you are doing something, maybe we can repost what you're doing. You can certainly repost anything we're doing. So I just want to put that out there that we are doing a massive social media campaign, a webinar series, all kinds of things for the upcoming heat season, the first time ever. Next slide. Yeah, heat and power outage, absolutely. This is a long slide. I just want to say that the NIHIS National, this will be our third time of doing the National Integrated Heat Health Information System National Meeting. Some of you I know have already been involved in a couple. This will be our third year. It's the 14th through the 18th, but the 15th, I mean. And the 15th is actually designed to facilitate state, local, tribal, territorial, community-based organizations doing their own heat planning. And then we have a time set aside on Thursday of that week to talk with each other about what you're doing, what else you need, how to facilitate that. So you can do it anytime up to April 15th or do it on April 15th. And then please come talk about your plans with us at NIHIS National and plan to participate. So we'll send a separate email out through this group, I believe, afterwards. We're doing the first ever National Heat Strategic Plan. I know that doesn't sound like much to you guys, but getting 26 agencies to work together and agree on something is kind of a hard thing. So we're pretty proud about that. All right, next slide. I mentioned that already, so let's skip over that and get on to the wildfires. Oh, yeah. No, keep going. One more down. Thank you. Next one should be wildfires. There we go. So I want to say two things about wildfires. Clearly, there's a connection between heat and wildfires. There's a connection between heat and drought and wildfires. And there are a couple different aspects of wildfires. One is the emergency response, which I think you're all dealing with. And I want to say, just if you are not already connected, I'm sure you must be, to your FEMA regional groups who are doing response, once there is an emergency, there is an incident command structure that I'm sure most of you know. And if you don't, please let me know there that you kind of just need to tap into. So if you're not, I will make sure you're tapped into that. One of that, so part of that is about a wildfire incident, and those are definitely exacerbated by drought and heat and wildfires. There's a coincidence with all of these that is increasing. I'm sure you've all noticed. The other part are things like wildfire smoke coming in from Canada or other places because the atmospheric circulation patterns are different. So the wildfire smoke is spreading more, and we don't actually know what's in the smoke. There's some research that's showing some very extremely dangerous and carcinogenic compositions in wildfire smoke that we're not aware of. So two aspects to wildfires. For emergency response, there's the command system. Let me know if you're not connected. I will help you. For the other stuff, there are some tools, if you go to the next slide, that NOAA has, but also the US government has a multi-agency wildfire group. So NOAA's piece of that is understanding before, which is the science and the prediction of it. During, we help with the incident command, and we also help with the recovery part. So that's a pretty straightforward kind of slide, and I'm happy to provide the right links for any of those. If you are not connected or want to know more, there's a whole network of folks who do that. And then if you go to the last slide, and then I will be quiet so we get time for the rest. These are the types of products we have for outlooks for heat and wildfire. This happens to be a wildfire slide. We have similar outlooks for heat. So even if you want to get a sense of what's coming, this is not a wildfire prediction, it's a risk prediction. So are you higher than likelihood than normal risk, that kind of thing. So we do have prediction tools that can help you plan and think about resource allocation and response and preparedness and sort of managing your people, the networks, and the citizens you serve. So I believe that the next slide, this is my last one. Oh yeah, forget El Nino. Yeah, and just to say thank you, and for Bob and the team here for having the foresight to address this issue, and for you guys for showing up. I really hope that you will be in touch with me for any questions and anything else I covered too quickly that you want answers to. Please reach out.
Thank you so much. Oh, sorry. Thank you so much, Julie. There are some questions in the Q&A pod that you might want to just reflect on so that we can respond at the end of the presentation. But right now, I'd love to transition to Candy Alvarez, who's joining us from the Health Center Partners of Southern California. She is the Emergency Preparedness Coordinator. And hopefully we'll have time at the end for all the questions. So Candy, go ahead, take it away. Thank you for being here, and just hope you will all continue to be safe in Southern California.
Thank you. Let me just make sure. Okay, good afternoon, everyone. Thank you, Julie. That was a great presentation, and I will definitely be using those resources and so many takeaways that I'm going to be using in my own planning. Okay, next slide. Okay, so today we're here for extreme heat and wildfires, but with a focus on a regional impact among health centers down here in Southern California. Next slide. Oh, I think we skipped a slide. Okay, that's okay. So just very briefly, let me introduce myself and what I do. So as the Emergency Preparedness Coordinator, I am part of a team for the Emergency Preparedness and Response Program. And what we do is we assist our member community health centers to help them prepare and respond to local disasters, public health emergencies. We give them direct support, and we represent them at the state, local, tribal, and the territorial levels. Each month, we have a monthly emergency preparedness peer network meeting, and this is where we all come together, all the emergency managers, the safety officers, even nursing directors. We come together and we realize as a region, like, how can we help each other, share best practices, and in our planning, how can we be prepared for all those hazards? Many of us focus on just our top 5 hazards after doing an analysis, and also wildfires and extreme heat is always usually at the top 2 of the 5. I also represent our members and our organizations in our healthcare disaster coalitions in our 3 counties of service. Now, to give you an idea, the health centers that I represent, we are down here by the border. So we have San Diego, Riverside, and Imperial, and we border with Mexico. So knowing that, we have a lot of additional challenges because we have to make sure we have the staff that live on the other side of the border, workers that come over. So we also put them in our plans. And then why am I here to explain what we do? So in our program, we train everyone for disaster preparedness. We make sure that the emergency preparedness coordinators, they understand what needs to be done, what goes into CMS, and we really encourage them to be part of our healthcare disaster coalitions for the county. Now, I really stress that out because those disaster coalitions, they're very valuable in the time of a disaster. They can send any type of PPE, they can send you tents. So I really stress that if you have one in your county, be part of that disaster coalition. And then through peer networks and work groups, we do a lot of drills and training, and we also do safety and security. Next slide, please. Okay, so risks. Now I'm just going to highlight for us. Back in 2003, October 2003, we had probably our largest fire down here in Southern California, the Cedar Fire. It was about 28,000 acres and over 400 structures were destroyed. So there were a lot of lessons learned from that. Let me go back to just the risks. So exposure to excessive heat. Of course, we've spoken about it. It's going to cause illness, injury, and even death. You get heat rash, sunburn, heat cramps, exhaustion, stroke. So our health centers, emergency managers, they work to make sure that we are ready to receive patients. And then the vulnerable individual, they're going to experience those heat-related illnesses or fatality anytime when the temperatures are high, but there's the prolonged periods of heat. So down here we have lots of heat waves. And with that, our electric companies, they always prepare us, and usually they will send us notifications of a power shutoff. So as a health center, we are an essential service. So we hope that we're on their grid to not be turned off. However, that doesn't mean that our patients won't be affected. So we also have to plan for that, and that will more than likely lead to a surge of patients coming in, with their respiratory illnesses. So the greatest risk for developing a heat-related injury are those that work or play outdoors. So many of them do not have access to air conditioning. They're socially isolated or they're on certain medications. And these vulnerable populations do include the children, our low-income individuals, pregnant women, older adults, and those with mental or chronic conditions. So Southern California, we have had a very long and intense history with wildfires. Very destructive, fatalities, and millions of acres of our land has been destroyed. And unfortunately, many of those have been caused by human activity, which means they could have been prevented. Now, of course, the effect on public health. That wildfire smoke reduces the air quality and it causes the eye and respiratory illnesses, especially among the children and the elderly. They burn in the residential areas, and also they can melt plastic water pipes. So this can spread widespread contamination of public water supplies. That is something also that we need to keep in mind. And these toxins lead to irritated skin and nausea, to more serious issues affecting the nervous, immune, and reproductive systems. And I'm talking more about burn soils, char, ash, and all that flows downstream and it contaminates our water. Okay, next slide. So very briefly, I'm going to highlight personal preparedness. Personal, family, and workplace emergency preparedness planning. So you need to be prepared to ensure your own safety and the safety and readiness of your family and loved ones. Our emergency managers, our site managers, and the leadership should all develop a culture of preparedness with their staff. Now, I know this is easier said than done. A lot of it has those challenges of, preparedness activities and training. It takes time, funding. So evacuating for wildfire. So this requires relocation without advance notice. And it's going to keep you or your staff away from the home for an unknown period. That's why we say be prepared. Make sure that your staff members are prepared, because if they are, they're going to feel more comfortable coming into work or even staying at work. Identify roadways that provide escape in each direction if possible. Try to keep your vehicle filled with at least a half fuel tank to ensure you can go through those routes and get to safety. During wildfires, a lot of roads are closed, or they're set aside just for first responders, so you may not be able to get through to get to your home. And having those go bags handy or an additional kit in your car will help you. So on ready.gov, you can find many checklists on what to put in your go bag. And right here, I just put an example of what we recommend. This is just something a little smaller, a more portable bag or kit in case you need to move fast. And emergency communications. So I will say communications is usually one of the #1 things that people find as a gap in their plan. Try to have multiple methods of communications. So in a wildfire, your landlines can come down, your mobile phones or cell phone towers, disruption in email, your mass communication systems. See, try to have some, and at the end of the slides, I will have some resources for those mass communication systems. And then very importantly, create a contact list. Have it printed, have it somewhere, keep it in your car, because many of us probably just call people from the phone and don't remember their phone numbers. So in an emergency, make sure you know the phone numbers to where your extended family is, phone numbers to the schools that your children go to. And then, of course, those non-emergency phone numbers for the police, sheriff's office, and the state police. Okay, next slide. Okay, so organizational preparedness. Now we're going to bring this into the emergency managers at the health centers. So I believe all of us should have an emergency operations plan. So I'm not going to go through that, but if you look very carefully, part of your EOP are those functional annexes, and this is what focus on those operations, what it is, who's responsible for carrying it out. And it just emphasizes all those tasks and actions. And so right here, I just listed what documents should be inserted to this plan. FEMA has a lot of great resources and templates, so you can create your own. Next slide. This is also part of your EOP, which should probably be more likely it'll be in the back. So for your hazard specific appendices, usually everyone has their top 5. And this is really where you list out everything by the specific hazard. So this is where we would have had it for extreme heats and for wildfires. Next slide. Okay, so I'm going to just briefly go through the lessons learned and best practices. Patient surge. So you are more than likely going to have a patient surge for those respiratory issues. And for us, what we've learned in some of the health centers is that it raises security issues, because now you have an increase in foot traffic coming into the front lobby and the parking lot, and now there's all this smoke that's entering into the building, as well as having patients that are waiting. They might be irritable. So make sure you're prepared, because if that AC is not strong enough for all those patients in your lobby, have extra fans and have cold bottles of water. These are 2 very simple things you can plan for, but it goes a long way. Let's see, direct relief. So one of our facilities, they had a surge of patients and they ran out of supplies, such as masks for respiratory distress patients. They were actually at the base of a mountain that was on fire. And so all these patients showed up and they called to us for help. And we immediately worked with our partner, Direct Relief, which everyone should have in their toolbox. Direct Relief is a wonderful organization, and they were able to send a shipment of masks within 48 hours. So next slide, please. Staffing support is also something else that should be in your plan in case your employees need to be evacuated or they need to leave work because their homes have been evacuated. So now they need to go home to their families. So what are you going to do if you're short-staffed at your health center, plus you're receiving a surge of patients? And then building trust and a sense of security with your staff members. Continued communication is really important because this will avoid misinformation, confusion, and your staff members can remain calm no matter how stressful the situation is. We highly recommend to have those communication drills. Test your messaging. Have pre-messaging already ready, those templates. Sometimes it'll come out from your IT department or your emergency management department so that they can send out these messages to patients, I'm sorry, to your staff and even to patients to not come in or maybe to go to a sister site. Okay, and also if there's a power shutoff because of all this heat, make sure you have additional sources of light, headlamps, flashlights, or chem lights. And of course, make sure your generators have their monthly maintenance. Next slide. Okay, so I wanted to highlight this. So a lot of this information I have taken from after action reports, from discussions with emergency managers, lots of trainings. And a couple years ago, there was a real wildfire incident down by our border. And right here, I have highlighted, if you can see on the map, the little house that I put on there, that is an administrative site to one of our largest organizations, which has about 20 to 30 medical, dental, behavioral health, all sorts of sites. And then on the other little house is actually a community center, which is very close to the border with Mexico. So they have a lot of staff that actually live in Mexico and then come across the border. So a couple days before, a couple days before August 31st, the emergency manager received a notification on their mass communication platform. They are 70 miles away, but they were able to send communication to the site manager 70 miles away and say, hey, my app is telling me that there is a wildfire. There's a brush fire right now. There's just a brush fire. I need you to be prepared. I need you to tell people, keep in communication because a lot of them are going to start talking. Should we leave? I want to go home. And so over the next 2 days, just by having that situational awareness, the emergency manager was able to figure out, what communication needed to go out to their incident management team, what communication needed to go out to the site manager and the staff. And then finally, on day 3, fortunately for us, that fire did make a turn and it went around the facility by about a mile. And so we highlighted that the reason why their response was so well received is because they had planned and they trained and they had a strong communications plan, and everyone was kept updated. So the staff really appreciated all the updates. And then if you look at the date, it says August 31st to September 5th. So as many of you know, September is National Preparedness Month. So it was a very good time for them to bring in those preparedness activities because it was scary. Those few days were very scary for everyone. It was getting close to the homes, the roads were closed, and they were worried if they weren't going to be able to come into work. Okay, next slide. Here are just a couple resources, mostly from FEMA, one from NOAA. These are great. You just click on these links, they're live links, and it will give you so much information. Next slide. Okay. And so I just want to thank everyone. And also these images that I put on here, it's just a reminder that at the end of the day, we want to go home to our families. continue our traditions, be with our loved ones. So as emergency managers, site managers, whatever it is, we, want to make sure that our staff is prepared. We want to take care of them, and we want to keep our doors open. So having a business continuity plan is also very important. Okay, and I believe that's it, and I did it right on time.
Thank you so much, Candy. And thank you, Julie, as well. And we have time for just a couple questions.
Hello,
And
everyone. My name is Nathaniel.
I'm sure both of you have seen that there's been a lot of questions and comments in the chat, as well as in the Q&A box. So thank you also for all of you for being so engaged. Candy, a question for you is, do you have any guidance or resources regarding risk assessment tools? Or can you identify any resources that health centers can use to enhance their preparedness, kind of similar to what you've done at your health center?
Yes, I've actually created quite a few templates. Just nationwide, a lot of it is geared towards hospital preparedness, but the health center environment is different. We serve different different community populations. I can actually create a secure link, and I can send a lot of templates that I can share with everyone. I think that would be best. And you can just put in your information, and there you go.
That would be great. Thank you, Candy. If you want to share that with us, we can, we have a Google site, so we can include that in the Google site. So if you want to share that with us, we can make sure to put that up for everyone to access. And then, Julie, a question for you is, you mentioned the work being done on the federal level around heat. And I know a lot of work is happening right now. How can health centers, NTAPs, PCAs, and others get involved, or how can they support the various efforts happening on the federal level?
Thank you for the question. I'll try to be really brief, but I think it's a two-way street. How can they support? So I appreciate that question. I don't want to put everything on NIHIS National, but I will say that one of the goals for NIHIS has always been to have a better and stronger engagement with state. We've had this partnership, like, on an org chart, this little thing that says partnerships, and it's hard for the federal government to partner with non-feds, right? It just is. It just makes it complicated. And so opportunities like this are amazing. So I would actually love to have even a follow-up with this group or whoever you determine is appropriate for, like, just putting the heat forecasts out. We have NIHIS National coming up in April. That's a part of a drumbeat. I would also really appreciate making sure that we are connecting with those of you who are serving unhoused or poorly housed populations, those with mental illness, the people, the underserved populations that we should be addressing. We've got our webinar series sort of planned, but let's do that together and make sure that we're reaching, like, the state and local resources and highlighting some of the successes or maybe some of the gaps. So I honestly, it's not even a punt. It's like the whole reason I'm here. I would like to have some ongoing dialogue. I would like to not just be me coming here talking. I'd like to have some pathway for engaging as we move forward. And I defer to you all on the best way for how to do that. But I would very much, that would be a huge boon for the U.S. government to have this kind of conversation on a regular basis.
That's
and Candy, like you too. great to hear what it's like on the ground, so let's connect the dots.
That's fantastic. And what a great opportunity. Maybe we should definitely follow up on that. So we'll continue the communication. So thank you for offering that out. Definitely something I think we want to continue and certainly engage in dialogue. So thank you. We are running short on time, but there were so many questions and so much engagement. Thank you to both of you for all of the information you shared. Can we go back to the PowerPoint briefly? Fantastic. So a lot of you have been asking about resources, and there are so many resources available. We have multiple slides of resources created by partner organizations, created by NTAPs. So we encourage you to, when you get access to the slides, to look at those resources and certainly access those resources. Next slide, please. The next forum, the final forum of this project year, will take place on April 11th. It will focus on workforce and community supports. We encourage you to register for that webinar. And then this series will continue in the next project year. So we are wrapping up year one, but it is not the end of the forum. So we look forward to your continued participation. You can also go to our Google site as well for information on past sessions. Next slide. Please take a moment to fill out the evaluation, which should be popping up.
And while that's popping up, I just wanted to add quickly to an added resource that's not in the slides yet, but will be added later, is that we do have a pre-recording with AmeriCares that walks through some of the tools and resources that they have on heat and wildfires too. So that will be in addition to what you saw today.
Thank you, Elena. So please take a moment to fill out the evaluation, and then we will see you in April. Thank you again. Thank you to my co-facilitator, Elena. Thank you so much to our speakers, Julie and Candy. Thank you to the other NTAPs for coordinating. Thank you to all of you for joining us today. So we look forward to seeing you. Oh, where is the Zoom survey?
It will open as soon as you leave the Zoom.
Perfect. So as soon as you leave, you will see the Zoom evaluation. So please fill that out. And thank you again, and have a wonderful rest of your day.
Bye. Thank you, Alexis. Thank you.
Thank you, everyone.